A low hemoglobin level, known as anemia, can be caused by various factors related to nutrient deficiencies. Hello vegans, hello vegetarians, with all respect to religion. If it's a religion, no question. So, nutrient deficiencies, chronic diseases, or body dysfunctions. Okay, here are the main factors that can lower your hemoglobin levels. First and principal one. What is this? Iron deficiency. Or we talk about iron deficiency anemia. It's a disease. Causes: lack of iron in the diet. For example, vegetarianism and veganism. I repeat it second time. If it's not a religion factor, if it's an original consent, so vegetarianism and veganism is something absolutely abnormal, aberrant. Next, blood loss. For example, heavy menstruation, ulcers, internal bleeding, yes, and sometimes hemorrhoid bleeding. Sometimes, of course. Principle is a very heavy menstruations and ulcers, internal bleeding. Increased iron demand when we've got during pregnancy, lactation, or active growth. Consequences is iron is essential for hemoglobin synthesis, and its deficiency leads to reduced ability of blood to carry oxygen. That's why we need blood, actually. Next, vitamin deficiencies. Vitamin B12 and B9. So vitamin B12, its deficiency can lead to megaloblastic anemia, which impairs the normal maturation of red blood cells. Folic acid, B9, a deficiency of this vitamin also disrupts the formation of red blood cells, so folio helps. So the rule is eat meat with vegetables, grasses, herbs, meat and herbs, Mediterranean diet. Next, chronic diseases, inflammatory processes and chronic illnesses, for example, kidney disease, cancer, rheumatoid arthritis, can suppress the production of erythropoietin, a hormone, my beloveds, that stimulates red blood cell production. Liver diseases that affect the formation of proteins and enzymes for hemoglobin synthesis. Blood loss, yes, actually, acute bleeding, for example, due to trauma or surgery, chronic blood loss. No, we used to talk about that, mentioned about stomach ulcers, oncological disease, inflammatory processes in the intestines. Next, genetic and hereditary disorders. Yes, for example, thalassemia, a disorder of hemoglobin structure leading to its insufficient production. Sickle cell anemia, red blood cells taken off on abnormal shape and are destroyed more quickly. It's abnormal shape of erythrocytes. Next, accelerated red blood cell destruction, hemolytic anemia, autoimmune disease, infections, hereditary defects in a red blood cell membrane, erythrocytes, exposures to toxins or certain medications, don't forget about that. What else? Poor nutrient absorption, malabsorption, gastrointestinal diseases, irritable bowel syndrome or post-stomach surgery can hinder the absorption of iron, vitamin B12 and other elements. Yes, pregnancy. During pregnancy, blood volume increases and iron is used to fetal development. Enormous quantity, huge numbers of ions we need for that. With pregnant women, of course. Fetal development, which can lead to fetal anemia in iron and vitamin intake if iron and vitamin intake is insufficient. That's why we do advise to pregnant ladies to eat a lot of normal, good quality meat, vegetables. If it's a problem, maybe take some medications, like vitamins. So symptoms of low hemoglobin, i.e. anemia, constant fatigue and weakness, dizziness of fainting, pale skin and mucous membranes. Look at this. Don't forget this sign. Huh? You see, it's a very good red color. Huh? Means I've got, thanks God, good hemoglobin. And next, the shortness of breath even with minor physical exertion, resembling heart failure, heart palpitations, i.e. tachycardia. No brittle nails and hair loss in chronic deficiency. So what to do? Good question. If you suspect anemia, low hemoglobin levels, consult a doctor for a blood test. Treatment will depend on the cause. No, actually, it's in vast majority of cases, diet rich in iron, meat, liver, for example, greens, why not pomegranates and vitamins, taking iron supplements maybe, or vitamins, treating the underlying disease, underlying condition causing the anemia. Okay, so low hemoglobin can be a serious signal, so it's important not to ignore symptoms and to get timely check-ups. Get it? Stay blessed. I hope I answered your question.